Okay, hi guys. As y'all heard, I'm a teacher by trade, so you're probably gonna get a little bit of teacher in me, so sorry. So, healthcare in the hood, I wanna give you guys a little bit of background on myself. I'm not hood. I'm not hood adjacent. I did not grow up near a hood, and that is a privilege that I have. I was actually adopted by two white professionals. One's right here, so to give you an idea, it's pretty white. Don't worry, he knows he's white. And went to private school, was able to go to Howard, the University of Wisconsin, and now I'm at Kellogg. So I had the privilege of being able to ignore the realities of the hood for majority of my life. Until I moved to Chicago, became a teacher out west on Laramie and Harrison. I don't know if that means anything to you, but it is not the best area. And I fell in love with my kids. And I realized I have been had the privilege of ignoring these people my entire life, and I'm done. So here's a map, if you didn't know what a map looks like. And this is my baby. His name is Taiwan. He's about 20 years old now, obviously not in this picture. That's just my favorite picture because he's so cute. And he grew up a few blocks away from the school I used to work at. So this is where the school is, on Laramie and Harrison. And if you can see right there, mHUB is where we are now. Because of where he is born, his life expectancy is 60 years old as a black male on the west side of Chicago. Earlier, we had heard, I forget her name, full transparency, but the life expectancy is 70 years old, which is true on average, regardless of socioeconomic class, regardless of neighborhood. Just in Chicago, she's correct that the life expectancy is about 70 years old. But if you are in this neighborhood, it is 60. 5.6 miles away, where we're standing right now, as a white man, the life expectancy is 80. 5.6 miles, and there's a 20-year difference. What you're about to see is different headlines and different pictures of students and people I know who have all died due to gun violence. These are all people I've known personally, and these are all funerals I have attended. This is one of the biggest issues facing Chicago right now. And today what I'm going to touch on here are the life expectancies, and the gap is being driven by 5 main causes. We're going to focus on number 2, homicide, and number 5, the opioid epidemic. So here are serious psychological distresses. So this is according to the Chicago Department of Public Health, and according to them, African Americans are more likely to experience serious psychological distress. Black females, 8.8%, and black males, 8%. One of the reasons I'm telling you this is because a lot of my students have experienced serious emotional distress due to the gun violence. So there's a direct link between the violence that is occurring and the mental health of the students that are still around. So the opioid-related overdose death rate among African Americans is 3 times higher than among non-blacks, and the homicide rate is 9 times higher. Again, this is in Chicago. So opioid-related overdose deaths. I recently had a student, because I'm still very close with them, come to me and literally tell me that she smokes because it helps her not feel. I had another student tell me the same thing, but specifically about popping perks. So they are taking drugs as a way of self-medicating because these are students who I know for a fact, I don't have to look at statistical data to tell you, do not have access to proper mental health care. So according to the Deloitte Health Equity Institute report, these equities account for around $42 billion in lost productivity annually. So what does that mean, Haley? I'll tell you. So I had a student who was shot in the leg. His name was Dante. He didn't die. He came back to school about a week later from the hospital with a bullet still in his leg, and he was walking around on it. I have never yelled at a child so fast and so loud. He asked me, why, what's the problem? What's the problem? I'm like, do you know how many main arteries are in your leg, sir? If you walk on it and it moves, you hemorrhage. He didn't know that. And so to give you an example of what that could look like, let's say he hemorrhages, doesn't die, he's going to the hospital, right? That's $100,000 in costs. So that's one example of the way that the money is draining. End of the story, he did get the bullet removed. So these costs are the result of delayed care, access barriers, missed diagnoses, and limited access to preventative services. Healthcare or health equity is everybody's business. We have got to stop ignoring it. So modeling the cost of health equity, as of right now, it's costing the economy around $320 billion. If it is not addressed by 2040, it is going to cost $1 trillion. Okay, this is sad. We get it. There's a problem. Well, for those who have the privilege of ignoring this problem and just drive past these neighborhoods on their way to O'Hare, I'll tell you why this can benefit you. So this is the zip code of the west side of Chicago, specifically the Austin neighborhood, 60644. Next to it is the zip code of West Loop, 60607. So 49.93% of the population in 60644 is on Medicaid, while 7% of West Loop is. So the possibilities are endless. Medicaid it's a green field for investors, and that's what people don't realize. When you think poor, people often don't think profit. And what we need to realize is, while yes, as on a human level this needs to be addressed, it can also be addressed on a financial level. So according to Rebecca Springer, a senior healthcare analyst at PitchBook, y'all know what PitchBook is, correct? Okay, amen. It is a much less competitive space in sort of, like I said, a green field. That's partly because Medicaid has historically has lower profit margins, but as more private insurers have contracted with state governments to manage their Medicaid programs, so too has the opportunity to use technology to help drive down cost by focusing on preventative care. We have got to focus on preventative care. So here are a few startups that I found and focused on, and some of them are fundraising that focus on the issues I bring to you now. So I put it in quadrant form because I like to be cute. Here is gun violence. So the Citizen app, they're not currently fundraising, but do any of y'all use the Citizen app? Okay, yeah. It stopped me from going to multiple times. One of the times, actually, a student of mine was shot down the street, and I heard about it from the Citizen app. Other health equity, my favorite right now is Acolyte Health, and it creates an avatar of the person's doctor, and it can speak, that avatar, let's say I'm your doctor, you'll actually see me talking in over 120 languages, or I can put the post-care into layman's terms, so I'm not speaking to you like someone with an MD. She Health Clinics focuses on women's mental health, and so does, I believe that's Backpack. It focuses on kids. So I wanted to take a moment, and my fellows don't know this, to dedicate this presentation to my student, Omira, who killed herself last week. I'm actually speaking at her funeral in 2 days. So this is a perfect example of the need for this. When I practiced this last week, this was not on here because this had not happened. So it's a real need. My sources are the Chicago Department of Public Health, American Medical Association, the Chicago Sun-Times, and my babies. So if you would like to talk more, feel free to email me at my Kellogg email, because I'm fancy now. And this is a QR code to my LinkedIn. Thank you.